Is it really possible for me to do the whole video pulling my stomach in? Afternoon, it is Monday the 6th of April. So I can even get the date right now. Things are changing. Times are changing. I am here doing a video about my scar. Because guess what? It's 2 whole years since my surgery and it just seems like it's gone like that. But then having said that, when I look back at pictures of me with the blonde hair and the scar going, it does feel like ages ago. So, peaks and troughs, peaks and troughs. I thought that I would, in true tummy tuck style, for those of you who know my videos well, wear my disgusting drain hole tummy tuck trousers with the incredibly sexy bum. My wardrobe now either consists of clothes like this, which show nothing, or leggings which are like, huh, yes. Here it is. Here's what I've worked for. Scar therapy is a term they use for when you've had an operation and you have a scar, the kind of massaging and care you need to give your scar so that it can disappear. My scar now looks, I barely even notice it anymore, especially on the lines around here. You can barely see it. On the camera, generally, it looks more defined. So if you were to be in the room with me, it would look a lot more natural, but the colours in the camera tend to pick it up a little bit. But I'm going to show you in a minute what it's like. But I will add that scar therapy does take a lot of work, and if you do want your scar to be invisible and to look like it has never been there, you do need to put in quite a bit of work. But then, well, that old phrase, what you get out of something is the effort you put into it. So mine looks great because I worked for it and I put in effort moisturising twice a day, cleaning it twice a day at the beginning, and it looks great now. So, on to the goods. Stop stalking me. Yeah. I will add, just for the mental note, I don't feel like I'm at my slimmest at the moment because I had a hell of a lot going on in my life and I haven't been eating the best. Even though I've marched for March and done great, I don't feel like I'm at my best. There's my disclaimer. For those of you who know, just for a bit of self-promotion, I am hosting a abs challenge for April. We did March for March, now we're doing Abs Kick April, and yes, there are going to be May, June, July. Yeah, there's loads more, but at the moment, it's abs. So, in celebration of my tummy tuck and the 2 years I'm doing this video. Woo. Don't worry, it's a sports bra. Where's it gone? Where's it gone? Oh. I do realise that I was so weird when I show my body on camera. So here is the scar. Obviously these are my tummy lines, and I have eaten like 3 meals today, so my stomach isn't looking as flat. Seriously? Here, let me try and get in a better light. There is my scar up to the belly, up to my boobs. I often get asked, Lauren, why do you have a scar up to your boobs? They've done it wrong. No, they haven't. I had way too much. I had 2 lines of skin. I had 2 big folds of skin here, which I could pull up, and a huge fold that used to come to about here. So they needed to cut it up the side, cut it up the middle so they could form it in to be nice and flat. And I wouldn't change my stomach for the absolute world. Right, what are we even here for? Scar therapy. Okay, so scar on the side, pretty much invisible. You can see it a little bit on the side there, and the side there. So this is my tummy. There you go. So yeah, this is my figure now, and I am really happy with it actually. The scar and everything is more than I ever could have imagined it to look like. Like my mum always used to say at the beginning when I first had my surgery, I can't believe how good it looks. I didn't think it would look this good, but I didn't ever picture what it would look like. All I imagined in my head was that I just wouldn't have the skin and I wouldn't have that burden of the loose skin. So in terms of the scar therapy, I'm going to show you it from the side now. This is my back. Yes, I still have the little rolls here, but hopefully they will be gone soonish because I'm going to be doing more training. So, how did I get my scar looking this good? Because I've seen quite a few scars and some of them are very red, some of them are purple, but it is all about how you treat your scar right from the beginning. As to how good it actually looks at the end. It's all about massaging, moisturising, hydrating your body with water, and obviously cleaning it first of all. So, when you first come out of hospital, you're going to have steri strips on your scar. As soon as you can take them off and wash in the shower, obviously wait and see what your doctor says about that, then you can start cleaning it and putting moisturiser on it yourself. So one of the first tips of something that you will need after surgery is when you have a shower, you need to buy a shower gel which is absolutely unperfumed. So something that's suitable for babies, newborns is perfect. I just bought a simple, I think it's Johnson's baby wash, and baby, you shouldn't use anything with perfumes in it because it will aggravate the scar. It may even get into it. So something really natural, perfume free. You could even get organic stuff nowadays, which is great for just washing, cleaning and that. So once you've had a shower and you're able to start putting stuff yourself on your scar, as I said, wait until your doctor tells you when that's safe to do so. I used to make my own salt water solution up, just putting a little bit of salt into some hot fresh boiled water and then adding cold as well. Obviously you don't want to burn yourself. And then I would get some cotton wool, I'd go in front of the mirror and I'd slowly clean my scar. Obviously around your belly button, that's going to be a harder area that's going to have to heal slowly, and the bit at the bottom for me, which is where the lines joined up, the line, the T, the bottom of the T. So this bit took longer to heal. So making sure you clean all of this. The salt water, obviously not too strong, not too hot, lukewarm, even if you have to like put it on the thing and blow it a bit so it's not going to scald you. Clean it, and then you are going to get some perfume-free, fragrance-free moisturiser. When I first started my scar therapy, I was using E45 Intensive Care. E45 Intensive Therapy Moisturiser. Fragrance free, as I said, absolutely perfect for healing. So I take some in my hand, make sure you have to warm it up a bit, because when you're feeling a bit fragile, cold moisturiser on your scar is a bit like, ah. So you're going to take your index finger and your middle finger, you're going to take your moisturiser, you're going to put it on the scar, and like, okay, so say this is the scar on my arm, you're going to push quite firmly and massage it like this. So imagine the scar tissue is underneath, you're going to be pushing it, and you're kind of breaking it up. Obviously don't cause yourself any pain, just push as firmly as you can to just try and massage it better. Just think about how much you're helping it. I would do this, I would clean it 3 times a day and moisturise twice, so once in the morning, once in the evening, and I did this for a year. They say you should do it a year and a half. Actually no, I think I did it about a year and a half. About a year and a half, 2 years, but the longer you can do it, the more effective it's going to be. I'm just thinking of what else I should say. So after about a month or so, I would start using bio oil as well on like the rest of my skin to just extra hydrate everything. Bio oil is amazing for scars and just general well-being of the skin. These are 2 other products I use for the rest of my body and including my scar. There's a Dove one, it's a firming one, and a Vaseline Intensive Moisture. Anything that, these ones you can use obviously when the skin's a bit more healed because they've got perfume and it's going to aggravate the skin if it's used too soon. There's also a couple of other products that I'll link below because my friend gave me the name, that's like a silicone gel because she had breast augmentation and as well as a tummy tuck. So she's been using it under there and it's looking fantastic, so I'm going to put the links below. It's not the most inexpensive product, but a little bit goes a long way, as I've heard. I get to work for these guys. What else? I've just written notes here. In terms of your general tummy, this isn't in terms of scar therapy, it takes a hell of a long time for the swelling to go down. I even looked at my 16 weeks post-op video, and I'm still really bloated on one side. So just make sure that you realise that it's going to take a long time for it to heal and a long time for it to go down, because at the end of the day you've altered your body in quite a major way. So it's going to take some time to heal. Another tip about the scar: if you go in the sun, make sure you put a factor, a really high factor. I put a factor 50, I think it's called Baby in the Shade, and I would just put it just along my scar, because if the sun gets to it, it will make it darker and it won't ever heal it, because it will burn it, because scar tissue is so fragile, you can't get it anywhere near the sun, so keep it out of the sun. And another thing, the skin, your skin, every single piece of you is an organ. So you need to keep your organ well hydrated. So for the skin to heal properly, make sure you're drinking a lot of water, 2 litres a day, on top of what you drink whilst you're working out. Once you're ready to work out after your surgery, again, wait and see what your doctor says about that. I didn't start exercising until about 7 weeks post-op, because I had my second op because of my blood clot on this side. Was it this side? Yeah, it was. I had my blood clot, but you can't even see it. So that's pretty much it. Make sure you just worship your new body and just treat it every day. Even if you think, oh, I don't want to do this, just think of the long-term product. Just think of how you want your skin to look like there was never an operation in the first place. And I feel like I'm finally kind of nearly getting there. Yes, I know I've got my line down the middle, but if anything, it just looks like a ready-made six-pack. So I'm not complaining. Yay! So I hope you enjoyed this video. If you'd like any more tips about tummy tucks, losing weight, anything, please comment below. And this looks weird. Please comment below, and I'll try my best to film new things, because yeah, times are a-changing. I've said that twice now, and I want to start filming more stuff, as I always say in every video. So yeah, I couldn't be happier with my tummy right now. I'm gonna start a new 6-week program soon in terms of my weight loss. Eek! So exciting things are coming. Thank you so much for watching today. Keep losing, keep smiling, and I'll see you very soon. Bye!